And now, what if those same technology companies used AI to manage that relationship? Which
Right.
creates all new levels of complexity.
Yeah, and that's a great thing. I mean, I've spoken with many guests about the utility of AI at a point of care moment. So the existing model is a disaster. You have about 6 minutes on average with your physician, of which
Yep.
5 minutes and 45 seconds are spent with the guy or gal typing into an EHR. There's minimal contact between physician and patient to a large extent because of the time constraints and the sheer idiocy of the input. Physicians are typists at this point. So if you get AI in the background to record the conversations, to translate requests into ICD codes, to double check managed care alignment and access in real time, then you have this really worthwhile, fairly intelligent assistant. But the price you pay for that is eavesdropping on every aspect of that experience.
Right.
And we've historically given away our privacy for convenience in virtually every aspect of the evolution of digital, right?
Except this one.
Except this one. But where does it go from here
I
is
don't
then the
know.
question.
Exactly right. I think
Yeah.
ambient AI is the big question people are battling with. And when I talk to when I talk to people in the AI world who want to work with life sciences companies, they inadvertently, not inadvertently, like almost without exception, will point to the fact that, well, people had these same privacy concerns when they were talking about bring your own device. We got over it. Well, people should get over the whole patient privacy piece as well, and or like pharma company IP piece as well. And you're kind of going, not the same thing.
Yeah,
And
it's a different category altogether. And it's not only about privacy.
right,
Okay. One
correct.
reason we have a lot of these interoperability problems from a technical aspect, we've got all the different EHRs, the health systems do not talk to each other, isn't even so much privacy. And I'm being a little bit cynical now, but I'm sure you'll agree. It's the money,
Right,
honey,
right.
because this data is cashola and they want to keep that. And that's why we've got these walled gardens and the deep fragmentation of our healthcare system. Definitely privacy and security are an angle, but I think the big reason is money. If you hold on to that patient info, it's a gold mine for you. And if you make it shared and transparent and ubiquitous, then where's that lost revenue going to come from?
You're going to sell that data right back to pharmaceutical companies and go, wouldn't you want this data again? And
Right.
that's your secondary source of data of
Right.
money.
So it's a mixed bag of tricks,
Yeah.
but I see progress here.
Do you?
I see this interim step as a very, very healthy thing in our broken healthcare system. Sometimes you need to really push someone against a wall to bring about change. And the fact that we do have this kind of confusion, fragmentation,
Hmm.
and ambiguity, which is keeping you employed, I don't mean to take that away,
No, no,
but
no.
and there's always going to be fragmentation and confusion and ambiguity. So like a physician, you're always going to have your work. But I think this crisis is suggestive of paradigm shift, which is like it's inevitable that AI will become ubiquitous and also very, very helpful
Yeah.
to the point where it'll be indispensable.